My name is Glenn Furuta. I'm the director of the Gastrointestinal Eosinophilic Diseases program. It is so wonderful to be here today with my two colleagues, Nathalie Nguyen, an assistant professor here at the University of Colorado School of Medicine, and Calies Menard-Katcher, associate professor also at the University of Colorado School of Medicine. We practice within Children's Hospital Colorado in the Gastrointestinal Eosinophilic Diseases program. We wanted to talk to you today about eosinophilic esophagitis, a chronic disease, affects both children and adults. Patients can experience symptoms of problems with swallowing, food getting stuck, reflux-like symptoms, and abdominal pain. In our gastrointestinal eosinophilic diseases program, we provide multidisciplinary care in a collaborative way to try to improve the quality of life of our patients. In that privileged setting of meeting with patients and families, we hear and want to try to understand the barriers to care, what keeps us from doing the best thing we can for our patients. And in that regard, endoscopy has provided us with a focal point because of the problems that can occur with that with respect to complications, cost, time, and the limited amount of information that we may obtain. And in that regard, we think about how we can do research to address those barriers and then implement them in clinical care. And it's why it's so great to work with two experts. Dr. Nguyen is an expert clinician. She's also done research in this area. And now you're very familiar with the problems associated with sedation and traditional endoscopy. And maybe you can tell us a little bit about how you've innovated transnasal endoscopy to address that.
Thanks, Dr. Furuta. Here at the Children's Hospital of Colorado, we developed a procedure called transnasal endoscopy. Transnasal endoscopy is where we're able to perform endoscopy to assess EOE going through the nose into the esophagus without general anesthesia. Kids wear virtual reality goggles, and we spray the back of the nose and the back of the throat with a numbing medicine. While they're watching a show with virtual reality goggles as a distraction technique, we're able to go through the nose and into the esophagus to take pictures and obtain the tiny tissue pieces called biopsies, similar to regular endoscopy. These biopsies are looked at by our pathologist. The procedure takes us less than 10 minutes and requires no general anesthesia or IVs. Unsedated transnasal endoscopy has eliminated the need for sedation and reduces time and costs for our patients.
Thank you so much, Dr. Nguyen. It's so impressive how you've brought transnasal endoscopy to the forefront of our mind, helped us to reduce the cost, but also really, and most importantly, improve the quality of life of our patients. Thank you. The esophageal string test is a capsule-based device in which we can also help to assess the health or disease in the esophagus. It is a capsule that is filled with a string. The string is pulled out, taped to the cheek. The capsule is swallowed, leaving a trailing string within the esophagus. The capsule is dislodged into the intestinal tract, and after a period of time, the string is pulled out. The mucus that is adherent to the esophagus is then sampled for biologic proteins that can indicate whether or not disease is present. We are very happy with this type of technology because it's able for us to identify not only whether inflammation is present or not, but other types of biomarkers or ways to know whether the esophagus is healthy. Dr. Menard-Katcher, you've done so much translational research in helping us to understand how the esophagus works and have developed this novel technology, the EndoFLIP, for us to understand the esophagus better. Can you tell us a little bit more about that?
Thank you, Dr. Furuta. EndoFLIP is a device that was developed to measure the pressure, diameter, and function of the esophagus. A balloon catheter is placed into the esophagus during endoscopy and provides additional measurement of esophageal stiffness and if narrowing exists. These measurements help us to understand the function of the esophagus in patients with EOE and if chronic inflammation has led to narrowing. This can help us monitor response to therapy or disease progression so that we may tailor treatment strategies to the individual patient.
Thank you so much, Dr. Menard-Katcher. Well, I get so excited every time I get to hear about the exciting work that's being done here in the GDP and Digestive Health Institute at Children's Hospital of Colorado to help to improve the lives of our patients, to individualize the care and personalize that treatment that we provide to them. We're grateful to you listening to us today and are always open to hearing from you either by email or through our program. Thank you so much.